CEN test prep exam hard? Question 1. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 2. A female patient of childbearing age with abdominal pain should always be evaluated for Option A. Ovarian cysts. Option B. Pregnancy status. Option C. Endometriosis. Option D. PID. The correct answer is option B. Pregnancy status. Question 3. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A. A neurological status. Option B. A renal function and urine output. Option C. Skin integrity. Option D. Cardiac rhythm and rate. The correct answer is option B. Renal function and urine output. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as Option A. Gray-Turner's sign. Option B. Cullen's sign. Option C. Murphy's sign. Option D. Rovsing's sign. The correct answer is option B. Cullen's sign. Question 5. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide minus complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. A synchronized cardioversion at 100 J. Option C. Immediate high minus quality CPR and defibrillation. Option D. A transcutaneous pacing. The correct answer is option C. Immediate high minus quality CPR and defibrillation. Question 6. Murphy's sign is used to assess for Option A. Pancreatitis. Option B. Acute cholecystitis. Option C. Diverticulitis. Option D. Small bowel obstruction. The correct answer is option B. Acute cholecystitis. Question 7. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. Question 8. Hepatitis A is primarily transmitted via Option A. Blood and body fluids. Option B. Fecal minus oral route. Option C. Sexual contact. Option D. A contaminated needles. The correct answer is option B. Fecal minus oral route. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates Option A. Allergic rhinitis. Option B. Nasal mucosal secretions. Option C. CSF leak, rhinorrhea. Option D. Sinus infection. The correct answer is option C. CSF leak, rhinorrhea. Question 10. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates Option A. A damage above the midbrain. Option B. A damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Question 11. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A. No tetanus prophylaxis needed. Option B. A tetanus immunoglobulin only. Option C. Tdap or TD booster. Option D. A tetanus toxoid and tetanus immunoglobulin. The correct answer is option C. Tdap or TD booster. Question 12. Meningitis is an inflammation of the. Option A. A brain parenchyma. Option B. Meninges covering the brain and spinal cord. Option C. Peripheral nerves. Option D. A ventricles of the brain. The correct answer is option B. Meninges covering the brain and spinal cord. Question 13. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with option A. Gastroenteritis. Option B. Bowel obstruction. Option C. Irritable bowel syndrome. Option D. Acute pancreatitis. The correct answer is option B. Bowel obstruction. Question 14. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all 4 fluids. The correct answer is option B. Keep the patient NPO and provide aggressive fluid resuscitation. Question 15. The most critical treatment for a patient with heat stroke is option A. Oral rehydration with electrolyte solution. Option B. Rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Option C. The administration of antipyretics. Option D. Active external revarming. The correct answer is option B. Rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Question 16. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid-position and fixed pupils. Option D. A constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. Question 17. The priority patient for a trauma team activation based on mechanism of injury is option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Question 18. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A. Heart rate and blood pressure. Option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Option C. Respiratory rate and oxygen saturation. Option D. Is central venous pressure and cardiac output. The correct answer is option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects option A. Acute myocardial infarction. Option B. Thoracic aortic dissection. Option C. Pulmonary embolism. Option D. Tension pneumothorax. The correct answer is option B. Thoracic aortic dissection. Question 20. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is option A. Absent breath sounds. Option B. A dullness to percussion on the affected side. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Dullness to percussion on the affected side. Question 21. A patient with a Le Fort 3 fracture is at highest risk for option A. Dental malocclusion. Option B. Airway compromise. Option C, corneal abrasion. Option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. Question 22. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. Question 23. In distributive shock, the primary pathophysiology is option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 24. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, a dry skin and absent bowel sounds. Option C, hyperreflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperreflexia, clonus, and agitation. Question 25. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss. The correct answer is option B, diverticulosis.